So there's two approaches to replacing men's testosterone. We either have the ability to use testosterone itself, whether it's injectable or if it's placed on skin as a topical delivery system to restore testosterone levels, or we now have medications that when combined do a very, very good job of increasing the body's ability to make its own testosterone. I think when you look at both therapies, the end results are probably about the same. Men will have improvement in mood, libido, muscle mass, usually experience weight loss if weight gain had been a problem for them, as well as see improvement generally in erectile function, their overall mood, anxiety, sleep should improve. But the approach to therapy is very dependent on what long-term goals are for a patient. We really are thoughtful, especially in younger men with the potential for fertility problems. And one of the long-term downsides of using testosterone itself as a replacement therapy is that over time it will reduce a man's ability to conceive by reducing his sperm count. What we now tend to use, if an appropriate candidate is present, is medications that have historically been used to treat men that have fertility problems. When prescribed appropriately, we can use those same medications to increase the body's ability to produce its own testosterone. We've had many counts of men who have come in with very, very low levels, often less than 200 nanograms per deciliter, which is pretty severe deficiency. And using medications that have historically been used to treat fertility problems, we can get them up to very, very optimal levels. We have cases of men seeing levels daily of 1100 to 1200, which is likely significantly better than men who would be treated with more traditional measures. The benefit of that is we've now restored the body's ability to make its own testosterone. You're not dependent on daily topical application or an injection that you'd be given generally weekly. And I think when you look at the mechanism of delivery, it's just it's a much better, more elegant mechanism of repairing the problem of low testosterone if we can regenerate your body's ability to produce its own testosterone. Now, men who don't respond to therapy or men who choose the other option, which is generally injectable testosterone, definitely have significant results and feel much better than they had pre-treatment levels. But we do have many different options we can use to try and treat a man with low testosterone.